Hey guys, welcome to Conditions with Molly. Today we're doing a continuation of the cardiovascular system. Our condition today is myocardial infarction, also known as a heart attack. So myocardial infarction is a condition characterized by a complete or partial occlusion of a coronary artery resulting in tissue damage or death. The pathophysiology, in short, is a sudden interruption of blood flow to the heart muscle, which results in infarction or necrosis. You can find this condition in males more than 45 years old and females more than 55 years old, but it's usually more common in males. The risk factors and causes are hypertension, diabetes, high alcohol intake, smoking, obesity, gender, and as always, an unhealthy diet. The signs and symptoms of this patient: they'll have a chest pain lasting more than 20 minutes. The chest pain will have B, C, C, D. It'll be burning, crashing, constricting, or it'll cause discomfort. It'll radiate to the neck or the left arm, and it also occurs at rest. This patient will have pallor, pulmonary edema, sweating, low blood pressure, and also arrhythmias. Investigation you can perform on this patient is an ECG, chest x-ray, a CT, an echo, and MRI, and also the most important blood test is checking the troponin levels. There are two types of myocardial infarctions. On the other hand, we have a STEMI, which is an ST elevation myocardial infarction, and on the other hand, we have an NSTEMI, a non-ST elevation myocardial infarction. With the STEMI, there's a complete blockage of the coronary artery, which will result in a prolonged interruption of blood flow to a portion of the heart muscle. On the ECG, you're going to find that there's an ST segment elevation. And for this patient to survive, they need immediate reperfusion therapy. On the other hand, we have an NSTEMI. There's a partial blockage or a temporary interruption of blood flow to a portion of the heart muscle. The ECG will have an ST depression or a T-wave inversion, and in this occasion we don't need immediate reperfusion therapy. Moving on to treatment of this patient, we have our non-drug treatment and our drug treatment. In our non-drug treatment, we're going to admit the patient and perform resuscitation only if necessary. The patient must stop smoking, they must decrease their alcohol intake, they must go on a diet, and they must exercise 40 minutes 3 times a week. Then, on our drug treatment, we have a mnemonic called MONAX. MONAX stands for morphine, oxygen, nitrates, aspirin, clopidogrel, and streptokinase. In this instance, you don't give the medication as the mnemonic says, but it helps you remember the medication that needs to be given. So you're going to start off with oxygen. You're going to give it 40% BVM if the sets are less than 94%. Then you're going to move on to your aspirin, and then you're going to give your nitrates, which is isosobide dinitrate. Now with the isosobide dinitrate, you're giving it to see if it's not an angina, because remember, if it's an angina, a nitrate is going to resolve the pain. Then you're going to give the morphine to help the patient with the pain, and then you're going to give your streptokinase, your clopidogrel, and then with the TTO, you have to give your patient aspirin to take indefinitely. Moving on to your complications, you have heart failure, arrhythmias, cardiogenic shock, pericarditis, thromboembolisms also, pulmonary muscle rupture, and ventricular aneurysm. Again, thank you for listening, guys. This is Conditions with Molly. Like and subscribe, and the comment section is always open for questions.